Hello, everyone. We are Group 1, and our project focuses on the business ethics and potential of healthcare data mining. Over the course of our presentation, we will share some introductory information on healthcare data mining and HIPAA, the pros and cons of healthcare data mining, 3 separate cases, and leave you with some discussion questions for reflection.
Government agencies, health information exchanges, mobile device companies, online applications and platforms, social media, and collaborating hospitals, insurers, and physicians are accumulating vast amounts of health information. Rapid progress in data architecture, storage, and analysis has opened avenues to leverage that information in new and innovative ways. Technology has created new business opportunities for healthcare entities, covered entities, business associates, and others to use health data for financial purposes. The ability to integrate, synthesize, and share complex health information can lead to enhanced coordination of care, potentially resulting in better health outcomes and lower costs. Health Insurance Portability and Accountability Act of 1996 was created for the safeguarding of patient privacy rights and protections for persons changing jobs and seeking a change in coverage, limit the exclusions of pre-existing conditions, prohibit discrimination of employees and dependents due to health status, and give people the right to purchase individual coverage. Data mining under HIPAA is where healthcare providers utilize big data collected and algorithms to determine risk for illness. It's often determined by the purchase of information collected from credit cards and other consumer loyalty programs, public records, etc., to determine which people are at the most risk of getting sick. HIPAA requires covered entities to protect patient data. HIPAA privacy rules do not apply to government-funded programs whose principal purpose or activity is unrelated to the provision of healthcare. So what is the value of healthcare data mining? Well, Grandview Research predicts that the healthcare analytics market will be worth $53.65 billion in 2025. Ernst & Young estimates the projected growth of healthcare costs to outpace U.S. gross domestic product and inflation with over $765 billion in unnecessary healthcare spend.
Many experts believe that data mining will bring considerable savings to the healthcare industry, with some experts believing that it will end up resulting in savings of nearly 30%. In the past decade, we have seen a large emergence of EMR systems. These have allowed for the collaboration of doctors' offices throughout the entire country in treating patients, as now a patient's file can be pulled up in a matter of minutes. EMR systems have also led to a more efficient use of doctors' times, as they have no longer had to search through file cabinets looking for a particular record. Now they walk into an office and they pull up a record and they can immediately see what they're looking for. The future of data mining in the healthcare industry is through artificial intelligence, and the great benefit of artificial intelligence will be for preventative care. As data becomes more and more readily available, hopefully they will be able to use large quantities of data to see early warning signs in diseases and cancers that will allow for treatment and preventative action before any symptoms of the disease is even noticed by the patient.
While there are many benefits to healthcare data mining, there are also risks. Healthcare data is valuable on the black market, increasing the risk of a cyber attack. Hospital operations can be shut down by hackers looking for ransom money, or they can sell this information to the highest bidder. Information management requires a large capital and operating investment. Companies that collect this information must update systems to prevent unwanted access and test and train employees to use the data appropriately. There are also limitations to interpreting the data that we collect from programs like Watson Health. Currently, Watson can only recommend a diagnosis or a treatment. What will happen if we follow Watson's advice blindly and it is the wrong decision? Finally, how do we value our personal privacy? Are we okay with our data being used for programs like Watson or other AI technologies? A first business example involves one of the many data cyber attacks that have occurred over the past few years. In 2015, Premier Blue Cross of the Pacific Northwest announced they had suffered from a malicious cyber attack where 11 million financial and clinical files may have been stolen. The Ponemon Cost of Data Breach Study estimates the cost per stolen record in healthcare to be $380, meaning Premier Blue Cross has a potential of $4.2 billion liability from the stolen records, and more if they are found to have been negligent in storing and protecting the data under HIPAA standards.
In another business example, Orlando Health in Florida utilized Watson Health to integrate all patient information to identify health gaps and engage with patients. They identified 270,000 people living with some form of care gap and generated $6.6 million in shared savings. The most recent case study is the United States Department of Justice versus Dr. Luthra in the District of Massachusetts. Basically, Luthra allowed a drug rep to access patient files without their consent and received kickbacks from the drug rep and the drug company for doing so. The result for the kickback scheme was a $125 million fine.
So, what is a hospital or payer or any entity that collects and studies data to do? Is it right to amass all of this personal information for the benefit of the greater good, or is the risk associated with it too large and our personal protection more important? Therefore, we have a few discussion questions for you. Should corporate entities be allowed to collect personal health information? And if so, how should they go about protecting it? And are you comfortable with your personal information being available for these purposes?